Hillsboro Medical Center has been a 100-year-old community hospital that most recently partnered with the Academic Medical Center, Oregon Health and Science University, the only academic medical center in the state of Oregon. With this partnership, we started an internal medicine residency program. The inaugural class with us 8 students launched in 2021. Dr. Ricci and I initiated this project with the intention to educate this inaugural class in cultural competency and delivering care to diverse populations.
Our community is defined by about 23% of people who identify as Latinx, and we weren't effectively serving that population well. And we noticed that even though this is a large proportion of our local population, just a small proportion of those patients were being seen in our clinics. And we wanted to figure out why that was. So our work sought to connect with this community through a trusted partnership we have with Salud Services, which is a mobile van that does outreach to the migrant and seasonal farm worker population.
We actually created flyers and distributed them to the farm workers, encouraging them, inviting them to our focus groups.
So that research doesn't always ask directly of that population what their needs are. And so I think for us, a piece of feedback that we've received is gratitude from our patients that we have involved them in the research process along the way. For example, even after we've analyzed the data of our patient focus groups, we then went back to that patient population, that our focus group, we brought them back together and said, is this right? Do we get these themes right? Did we hear you correctly? So what we've learned in analyzing the data from our patient focus groups is that there's really practical matters that can make an enormous difference to making patients feel welcome into our clinics, for example. One of them would be the universal use of interpreters, because when patients come and they're not able to effectively communicate with our staff, they feel lesser, they don't feel heard, and they're not able to get the care that they need.
I cannot emphasize enough on how important it is to have trust in relationships, and trust comes with spending the time to getting to know each other. So this grant is our effort to get to know our Hispanic patients, their needs, their priorities, their barriers, their challenges, and then also work to address some of those needs and overcome some of those barriers.